There's some interesting studies. For example, one of those that I reviewed in the Journal of Neuroscience showing that when they did brain scans, they compared fibromyalgia patients and control group that didn't have fibromyalgia. They found reduced gray matter volume in areas linked to cognition and pain modulation in patients with fibromyalgia. So those are structural changes that have shown that could be or very likely to contribute to the pain perception and also cognitive decline. There's another study from 2013 published in the journal Pain, talked about fibromyalgia patients require greater brain activation to perform the same cognitive task as controls. So that suggests that the mental fatigue results really from the increase of neuronal energy demand. Or I'm sharing this with you because our next supplement that we're going to talk about or strategy is a supplement that is coenzyme CoQ10, which is important for our cellular production of energy. CoQ10 is essential cofactor, but it's also a powerful cellular antioxidant. So it helps prevent ongoing damage to our nerves, our neurons. So let's take a look at this interesting illustration that we've created. This is based on two studies that we have looked at. One of them from the Journal of Clinical Biochemistry, and the second one is the Journal Antioxidant and Redox Signaling, which you can see the citations on the bottom left on the picture. And so essentially to summarize the function, how does CoQ10 work in alleviating some of the symptoms of fibromyalgia? We often see underlying mitochondrial dysfunction and oxidative stress, which leads to the gray matter damage with those patients or contribute to that. And CoQ10 plays a central role in the mitochondrial energy production. So now we're talking functional medicine, but we're talking about integrative strategies we can use, simple and affordable, to help those patients. So essentially, when we need CoQ10 to help restore energy production and cellular function in the muscles and nerve cells. And so when a patient takes CoQ10, it helps to reduce the free radical reactive oxygen species and also lipid peroxidation. At the same time, CoQ10 downregulates pro-inflammatory cytokines and helps calm the neuroinflammation and central sensitization. So altogether, when you look at all these different mechanisms on the bottom, taking CoQ10 can benefit patients. Of course, that takes time to achieve, but you can see here the general kind of like overview of how it works, the mechanisms. We like to explain the pharmacodynamic mechanisms on when we make a certain recommendation. So what is the dosage that we should consider that will be effective for those patients? So we always look, when we teach functional or integrative medicine, we always look at clinical studies, human clinical studies, for effective and safe dosage to help those patients. So there was a study published in 2013 that showed that supplementation with 300 milligrams a day of CoQ10, we'll post those dosages on the screen, for 40 days in adults aged 25 to 65 with fibromyalgia led to a significant reduction in pain, fatigue, and tender points count, along with improvement in mitochondrial function markers. The dosage is 300 milligrams per day. So here's a simple strategy that your patients can utilize.
Let's add in that compounding factor that Dr. Cohen that you were talking about earlier, right? And another strategy that you can use for a supplement is going to be magnesium. Magnesium malate or glycinate. Those are two forms that we often use as functional medicine and integrative medicine practitioners. Magnesium is wonderful because magnesium is needed for hundreds of physiological processes throughout our body. It's essential. It's an essential mineral. It's involved in muscle relaxation. This is really important for fibromyalgia. ATP production. This is another important factor with energy production. And then regulating the nervous system for these patients. And what it's going to do, it's going to help with the neuromuscular relaxation. It's going to reduce central sensitization. It's going to help with improving sleep quality. And then it may decrease pain amplification for your patients. And this was all according to a study that was done. And there's actually multiple studies on magnesium that is done on pain. One of them is from the Journal of Rheumatology. Dosage is going to be really important in terms of magnesium with fibromyalgia for clinical effectiveness. What this study did was they did 300 to 600 milligrams per day of magnesium, and this was done with malic acid for about 8 weeks. So this is a shorter study. And as Dr. Cohen was saying, we typically like to see, even with studies, that they're done at about 3 months, right? And so we often see that they start to see benefits even within the first couple of weeks to a month, but they get the most benefits at about that 3-month period. And this study was done on adults from 18 to 65 with fibromyalgia, and it showed that even at 2 months, they had improvements in pain severity, tenderness, and functional capacity. And you may be wondering, what supplement can we recommend for our patients? So let's take a look at a professional grade supplement or a product that can be really beneficial. And this is based on the study that we were talking about. This is from Designs for Health. I use this brand often. And this is magnesium malate. This is exactly what we were talking about. And you can see that it has the 300 to 600 milligrams at 2 capsules. So you might want to start with 2 capsules per day with them. Maybe you might want to go up to 3 capsules to get to that 500 to 600 level based on what your patients are needing, what their symptoms are, what their past medical history and their current medical history is. So, but this is a great brand that you can use, and it has the exact form. It has the dosages that we need. When we're looking at dosages and supplements, we talk about this often in functional medicine, that it has to be the correct supplement or the correct form, and it has to be in the correct dosages. And then also it has to be in the correct time frame, right? And so this is really important when we're using supplementation with our patients. And we want to ensure that it's actually matching the studies. And this is why we often include studies when we're talking about supplementation, because we want to show the clinical effectiveness. And these are things that both Dr. Cohen and I and all of the other practitioners in this program will use as well. And this is why we're using these supplements, because we've done these with our patients and we've seen the significance it has with our patients. And so with magnesium, this is best for patients with fatigue and with pain, because malic acid is going to play a role in the Krebs cycle and helps with ATP production. It's also helpful for fatigue and muscle pain, and those are 2 core fibro symptoms. And we can see that there are studies that are directly related to fibromyalgia in clinical trials. And there's other types of magnesium out there, but for fibromyalgia, we typically will look at the malate and the bisglycinate. And then Dr. Asia will actually teach some of the other supplements that can be used for fibromyalgia as well in the Integrative Health Practitioner Certification Program. So definitely check all of those lessons out with Dr. Asia.
I love, by the way, Dr. Asia's classes. We've had amazing feedback. And every week she dives into one specific group of conditions like cardiovascular, or autoimmune, or women's health. And so if you're interested in that, check out her program. We talked today about fibromyalgia. But what if tomorrow you see a patient with type 2 diabetes and they still struggle with neuropathy, or you have somebody who's coming in with digestion problems or endocrine hormonal imbalance, or you want to have strategies, even simple 2, 3, or 4 strategies you can give them right away. If you're interested in learning more of those, I would highly recommend Dr. Esha's program. Dr. Chill mentioned briefly her program, but it's a 10 week, so it's relatively short. We have now opened up another cohort, and for this month, and then we're closing it in the end of the month. We're going to start in the beginning of March, and this is the certification is an integrative health practitioner. It's a 10 weeks class. Every week, Dr. Esha is going to dive on Monday evening is going to dive into a specific group of conditions such as cardiovascular, one group autoimmune conditions, one group cardiometabolic, one group women's health, so 1 week geriatric conditions. So it's fascinating class. So it's a really cool classes that are included. You also got the phone app with all the protocols and the integrative nutritional herbal medicine clinical guide, which is only offered with this program. So again, we're opening a class right now. If you're interested, it's a 10-week starting next month with Dr. Esha, and then it's like 1 to 1.5 hours on Monday evening, and then there's like about 2 or 3 hours of on-demand classes, which you can access anytime or over the weekend or during the week a little bit here and there. But you get certified, you get all the clinical protocols, and you learn something you can already apply it the following day. So it's very clinically focused, quite an amazing program. And Dr. Esha is a physician who has years of experience in integrative medicine. She did integrative medicine internship or rotation, clinical rotation. She published in articles, and she was on Amazon Prime show about natural medicine. So she's very, very diverse in that, very, very sharp doctor, which I would highly recommend. I want to thank Dr. Chill for being here, sharing his expertise and years of experience with what works and some really cool studies that we talked about. So Dr. Chill, thank you so much for being here.
Thanks for having me. It's always a pleasure.
And I want to thank you for being that guiding light for your patients, to bring them hope, bring them strategies that can improve their quality of life. And this is really the best legacy that we can leave, we can have in our life. And so again, I want to thank each one of you for taking the time and effort to investing time and effort to learn those strategies and help your community. And so thank you again. Take care of yourself and have a blessed evening in the meantime.